Hi, welcome to my channel. My name is Kaylee and today I'm going to be making a video for prospective students or anybody that's interested in becoming a cytologist. This is especially for those that are trying to enter the UNMC program, University of Nebraska Medical Center. Woo! I have an Instagram account where I share more about what I do. I've been very flattered with how many people reach out to me on that account from all over the country and even different parts of the world. So I had no idea what cytology was because I was studying to become a physical therapist and I majored in kinesiology. How did I get from physical therapy to cytology? It was by fate. For a lot of people, it seems to be by fate. Not a lot of people know what cytology is, but we're gonna change that. I have a relative who, for years, they were always trying to get me to come work with them in the lab. And I just thought, I'm doing physical therapy. I don't really need anything to do with the lab, but I'll let you know if anything changes. Lo and behold, my job was not working out. The company shut down. I was laid off from my physical therapy job. I was living with my grandma. I needed a job really badly. I took a lab tour. They showed me the entire lab. They showed me what happens to a specimen. I kind of followed where they go. So after I finished my lab tour, I grew even more interested. So I took a second lab tour. I finally decided to apply to the open position and I applied to be a histology lab assistant. Working in histology was super cool. Cytology, you are interpreting cellular changes, and histology, you're working more with like tissue. I worked in the lab for a year and I gained a lot of experience. I took the time to see if it's something that really interested me. I think it's really important to see how the lab works before you get into the field. I don't think it's necessary, I just think it would help out a lot. I heard about the cytology program once I worked in the lab. I decided I wanted to apply in the next round of applicants. Working as a cytologist, you're pretty independent, which I love about the job. Typically, you have a cubicle. I haven't been to a place where a cytologist doesn't have like a really large work area, which I love. So the options you have when working as a cytologist may be a hospital, maybe a laboratory setting, or maybe in a clinic. A lot of people stay mostly in a hospital or a laboratory. The laboratory can be private or it can be corporate. If you do work in a hospital, your day is probably filled with a bunch of surgical procedures, which is personally my favorite thing about the job. I love going on surgical procedures. I think they're so cool. The kind of surgical operations you would attend would probably be an EBUS. In that procedure, they have an ultrasound attached to the end of a probe. They're going down the airways of your lungs to investigate anything like enlarged lymph nodes or any kind of tumors that are in the respiratory area. The other procedure that you're more likely to attend if you work in a hospital setting would be a thyroid FNA. A thyroid FNA is prompted when they find a nodule in your thyroid that is large enough to warrant an FNA procedure. On all of these operations in EBUS and thyroid FNAs, your job on these operations as a cytologist is to perform a ROSE assessment, and a ROSE assessment stands for Rapid On-Site Evaluation. A ROSE evaluation can range, but it's usually pretty quick. They will collect the cells and spit it to you on a slide. You will do a diff quick stain, and then you're going to assess with the pathologist if the cells are adequate. It's mostly done to assess adequacy, whether or not the sample they're collecting is adequate enough to render a diagnosis. So then you'll take the remaining specimen back to the lab and you're going to prepare different stains for that specimen, which is usually decided for by the doctor. If you're going to work in a laboratory setting, you are most likely screening all day, which some people don't like that. Some people do like that. I think it's really good to help you practice and get your screening speed up. The work environment in a laboratory setting is typically quiet, but not to say we don't talk and hang out and socialize. Some places like to chat or have background music going. I personally like to listen to a podcast or music. Helps me zone in. Some laboratories send their cytologists to go on EBUS procedures or thyroid FNAs when a hospital is maybe short some staff members, or the PA is out sick, or they just like to have the cytologist perform the ROSE evaluation. One thing that's great about cytology is that you can travel and work. There are a lot of travel agencies that are seeking cytotechs. So if you've always wanted to travel and do travel work, then this is perfect for you. When I spoke on the phone with an agency, they talked about paying for my lodging and my gas and my food and taking very good care of me. I guess I would compare it to like a travel nurse. They pay very well. So the average salary for this job ranges depending on where you're at in the country and also your level of expertise. The lowest salary I've heard of so far is maybe around 74K, and it can range up to around 90K is where it caps, especially for first year cytotechs. There are some places where you can accrue weekend pay rate. The weekend shift differential is actually pretty nice at a lot of places. So if you pile that on top of your regular salary, I'd say you're good to go. So the lab I worked at was in Dallas, Texas, but UNMC offers a lot of satellite locations. Unfortunately, because of COVID, there weren't enough seats for me at Dallas. So they invited me to complete the program at the home campus, which I thought was pretty cool. And at first, moving to a different state seemed kind of out of the picture for me, but I thought this career, I've heard great things about it, and I thought it would be way worth it, and it would just be an investment. The UNMC program, you can choose to complete a master's, and the master's is a 2-year program, or you can continue on to finish your PhD. UNMC is really great when it comes to research, so if you have that option and you're really into research, I say go all the way. What I loved about the UNMC program is that we had mini rotations where we kind of rotated for a couple weeks in different departments of the lab. When it comes to working in the lab, you start to learn that we kind of all work together to paint one big picture for the patient. So cytology is a specialty, microbiology is a specialty, flow cytometry is its own thing, histology is right there with cytology. Cytology, the best way I can describe what I do is that I'm kind of working alongside a pathologist or a cytopathologist. We are screening for other clinicians and people who send things to the lab. Our bread and butter is the pap smear. We also get samples and slides from anywhere you can think of in the body. Respiratory, spinal fluid, urinary, breast, female genital tract, gastrointestinal, lymphatic, kidneys, liver. An oncologist would be somebody who's more on site at the hospital with the patient. With cytology, we are more closely working with pathology. The pathologist and the cytologist, all that typically is kind of the behind the scenes work. I was one time told that the pathologist is the doctor's doctor. The pathologist is the person who is helping the oncologist come to a diagnosis. And the pathologist has a sidekick, aka the cytologist. So cytology is a little bit different compared to an oncologist. I would say that the oncologist will be more involved with the surgical operations. They will go ahead and send these specimens to the lab where the cytologist and pathologist will render a diagnosis together. For UNMC, the way they're conducting their interviews is through a program called Cura. You are kind of recording your interview. They ask you a question. They give you 45 seconds to think about your answer, and then you answer it and go on to the next question. My interview was done over Zoom, but I will give the best advice I can think of. You should have one main point as to why you're going into this program. Something to fall back on, kind of like a purpose. So every time you're asked a question, it's really easy to construct your answer. They really admire if you have looked into the program and you know your facts about the program, you know things about your professors and the pathologists. I think what would really impress the professors and the faculty is if you kind of know how a laboratory operates, if you can drop medical terminology. I would make it very known that you're an independent worker. One question I remember from my interview that I think was very important was, am I willing to relocate? The reason they asked that is because right now cytology is in high demand. I realized it was because I was going to be moving around for my clinical rotations, even when I started off in Dallas and I had to move to Nebraska. And lastly, I think the most important thing to take to your interview is your wholehearted passion for this field. They want to know that you genuinely are serious about helping people. I really hope this video helped answer at least some of your questions. If you have any more questions, please feel free to reach out to me. And I can't wait to see you out there.